in a sense, you have the company where it's like a middleman in a sense. Staffing is actually really big. We haven't even talked about staffing on this podcast before, but so you recruit people for jobs pretty much. And staffing, you could do staffing in any type of IT staffing, nursing
Exactly.
staffing, stuff like that. And then you charge the hospital and they pay you and then you pay the difference. How lucrative can that, like, what's the profit margins on those?
It could be as much as 50% because it depends on what the hospital is willing to pay. In home care, the profit margin is about 11 to 13% because it's getting Medicaid dollars and the margins are small there. Just like the margin for a hospital is only 8%, right? Hospitals are functioning on an 8% margin, but with staffing itself, it could be as high as 50 because it's how desperate are they for staff and what are they willing to pay. But usually you're charging like a 30% markup over what you're paying your staff. That's kind of
so 50%. The best case scenario, if they give you 200, you give the employee 100,
and you taking 100.
Yeah,
clean.
If that's what they negotiated, right? So with the nursing it's usually about 30% over because the hospital and the nursing facility is thinking, well, what do we pay our nurses? What about matching their payroll taxes, right? That's another expense. Their workers' comp and their healthcare expenses plus PTO. So when you're trying to, you want to come in as close to their price or their overtime price as possible because they're either going to mandate their staff to work overtime or they're going to use an agency. And if you come in for like $1 or $2 less than what that figure is, it's now a savings to that facility. And they'll be interested. So you could charge like 30 to 50% above because if it's at 50%, you know you're hitting the time and a half number. Right? And they're still they still may be short. So they still may go with you even though it's equal to their time and a half number. And that doesn't include the workers' comp and taxes that they're going to have to pay as the employer. So
at $400,000, the offer for the license, did you guys decide to sell or you decide, you know what, we got something great here, let's hold on to it?
Hold on to it. And at the same time, the market crashed. So in the staffing business, right, you have a contract that says, all right, you're going to pay me $45 an hour for an LPN nurse. And I'm going to pay them and we're going to provide the service. But what ends up happening is that you have the terms that may be every 30 days, every 60, every 90. So you're front running the payroll until you get reimbursed on your invoice, right? You're not getting paid weekly from the nursing facility. They don't pay out weekly. So right before the market crashed, we were growing pretty aggressively and we had line of credits to float that money. So just like what's happening right now in this crash, the banks pull back on those line of credits. So we couldn't even provide as much services anymore. So it's like, well, what are we going to do? Because now we can only provide like 30% of our services. And that's why we're even flirting with the idea of selling. Because it's like, if we sold this for $400K, that helps us, have more buffer money. But then we thought like, well, the home health aides get paid less than nurses. So let's just start spooling up that side of the business, making, a smaller spread, but we can grow this beyond. And people are thinking about paying, almost $500,000 for the license. There's got to be some money here. And that's where that pivot took place.
Is that true just for New York State? Or was that something that was happening throughout the country where licenses were being seized?
Oh, no. That's New York State. Like right now in Florida, where I am and expanding on my new venture, there isn't a moratorium on licenses. I'm applying for a license right now. Some states, I think Michigan, doesn't even have a license to operate. You could just start a home care agency without any oversight, which is kind of nuts to me because New York is heavily regulated. California, of course, heavily regulated. So, short answer is that it depends on your state.
So a friend of mine in Ohio, he has a health clinic, and he was kind of explaining it to me, and it was crazy because he was saying, like, with the healthcare industry, the common mistake that people make is that they think that they actually have to be in the field to actually be an entrepreneur and like open a type of business. But you don't have to be a doctor. You don't have to be a licensed doctor to have these type of business, right? Like that you have. Like, you're not a licensed doctor, right?
No, I'm not a licensed doctor, but in most states, you have to have a licensed person, like either a nurse or a physician, on your founding team if you're gonna do a licensed home care agency. But as a staffing firm, you could turn around and start one tomorrow.
So your mom filled that role, right? She was the nurse.
So that's how it worked. So, you know, if you're thinking about getting into this business, like I get inquiries all the time on my channel where it's like, how do I start? How do I start? So I started showing them step by step. This is how you do it. So step one, if you're going to go and become a home care agency, you got to just research your Department of Health website and find out, are they issuing licenses? What is the application process? And what are the rules and regulations, right? Because those regulations are going to dictate what your policies are and how your policies need to be drafted. And you're going to need to develop your policies when you're applying. It's actually a pretty grueling process because you're doing like 400 pages of policies, your forms that you're going to be using to do your assessments. It's pretty intense, but you could also hire a consultant to help you with that. Like right now in Florida, since I'm in a much better financial position than when we started the home care agency before, I'm just paying a consultant to handle the entire application process and working on building my team while they're doing that piece rather than physically typing. But from the staffing firm perspective, you just need you could get like a boilerplate, generic staffing firm contract, pull that up on Google, determine what area you're going to focus on, if it's going to be healthcare or nursing, and then decide what your rates are going to be. Make sure you're cushioning in at least 30% spread because your payroll taxes are going to cost you close to like 10%, and then your workers' comp is going to be around 6 to 7%. So then you're only going to be left with like 20. So at least you charge a 30% markup if you're going to do that. But the process, once you get licensed, is all about what relationships you build and executing on your marketing strategy so that you're finding those patients. But on the staffing firm side, the process is call the nursing home, call the hospital, speak with either the administrator or the director of nursing and say, I am a staffing firm, I'm looking to provide services, do you need coverage? Best time, summertime. Why? Because people are going on vacation, they're going to be short, right? So that's when people are going to be desperate and they'll say, hey, you know what? Sure, send us over your contract and we'll have it reviewed. The first contract that I got when I expanded in Long Island took me about maybe 2 weeks of phone calls. I just literally downloaded Nassau County nursing homes and I just picked up the phone, 20 years old, boom. Yep.
Cold calling.
You created the contracts yourself, or you sat down with a lawyer? How did that process work?
Oh, my mom took a copy of the contract that her nursing home is using, and I just retyped it.
All right. Well, in the next segment, we want to talk more about the business and also about the acquisition that you guys, I know you were saying off camera that somebody had offered you some money and you looked at that, and because we like to talk about stories like that on EYL because these are things that the general public does not know and isn't privy to. So, we're going to talk some more in depth about the healthcare field in the next segment. All right. So, in this segment, we're going to talk some more about some actionable items. This is what everybody loves EYL for. So you have two different businesses with the staffing firm and the nursing. But first, I want to talk about staffing. So for people, because you said that's probably like the more practical thing that really anybody can do as a staffing firm. And like I said, staffing firms are big on a variety of different levels, not just in medical. All over, staffing firms are extremely big, and pretty much you're just bridging a gap where somebody needs work and their employees that are skilled to work, but they got to come together. So the staffing firm's job is to find the qualified employees and match them with good employers. So what are some steps if somebody wants to start their own staffing firm?
I'm going to try to break it down as simple as possible. If you're going to be starting a staffing firm, the first thing that you're going to need to do is get your hands on just a basic staffing contract, okay? Get a contract, review that contract, and part of that contract is going to have a fee schedule, right? This is what you're charging for the positions, right? So if you're starting with nursing, start with a fee schedule for RNs, a fee schedule for LPNs, which are licensed practical nurses, and then for nurse aides, because those are the most utilized workers in a nursing home or in a hospital, right? So that's one thing that you want to have. But you're going to do your market research next to know what is a nurse commanding as far as salary, what is the LPN commanding as far as salary, and the nurse aide, right? So that you know what you're supposed to be paying out.
Specific to each state that you're in? Specific to the state that you're in?
Yeah, specific to your region,
okay.
Right? Even in New York, New York City is going to charge higher rates than Buffalo,
exactly.
Right? So you have to just research your local market just to know what does it, how much are you going to be paying? Because that's going to dictate how much are you going to charge, because you obviously need to cover that. You're going to need to cover payroll, you're going to need to cover workers' comp, and then you're going to need your profit margin, right? So I advise that whatever the local rates are, charge a minimum of 30% more, or as much as double, because it depends on, once again, the need of that position. So once you have your contract set, the next thing that you should do is obviously incorporate yourself, right? Either go the LLC route or the corporation route, just so that you have an entity and some sort of barrier between you and liability, right? That's the purpose, and also the tax benefits. So make sure you go out there and incorporate yourself. You could do that on LegalZoom. I use a service called Bloomberg Excelsior. I'll send you guys the link. I like working with them. They're quick, and they'll set up your corporation within a day or two. They'll even apply for your tax ID number, all the things that you need to be, recognized as a business, right? And that cost in New York is going to be anywhere from like $300 if you're doing a corporation to like almost $2,000 if you're doing an LLC, because of the publication fee that's associated with that. Because LLCs have to, publish that they're coming into existence. So once you have your contract and you have your entity set up and you have, you can open up a bank account in your entity's name, the next thing that you should do is probably hire a few people, right? Get your application. You can pull up any generic application online, but you're going to need to get an application so you can actually onboard and have a pool of providers, nurses, nurse aides, LPNs, whatever you're going to be hiring. And, once you do get a hit, you're going to be able to staff. You don't want to get into contract to provide staff and you got no staff, right?
Right.
So I think if you're a healthcare professional, it might make the most sense to staff yourself. Be one of the people that gets dispatched. So at least you know that you could fill in certain gaps if you get that immediate call, that you could work that shift yourself.
How many people are you putting on the team to start? Are we doing like 2 or 3, including yourself? So you got a 4-person team?
If you're starting a staffing firm?
Yeah.
I would at least 3 in each position that you're marketing. So at least you have, some depth to your staff.
So we had RN, LPN, and then health aide. So that would be 9 people?
Yeah.
Got you.
So how do you because like there's a shortage of nurses right now in New York, and they're like begging nurses to come from all over the country, right? So this is like a perfect. If somebody had a staffing agency for nurses right now, it'd be perfect. But like, how do you find the candidates? Like, I'm sure
attract talent. Okay, so first you're gonna just you're gonna post on whatever you can: Indeed, LinkedIn, Facebook jobs, wherever, Craigslist. Just post that you're hiring. And the thing is, nurses, most nurses I know are working 2 jobs, right? They're usually the top earner in their household, especially in our community. They're working 2 jobs, sometimes 3 jobs. So they're always looking for jobs, right? Because one, the jobs exist and they're always looking. But if you dangle a carrot like higher rates than what they're normally getting paid, then that also attracts them. So let's just say the average was 30, but you're paying 33, then nurses who are working for some other agency they'll give up their part-time job and work with you for a little more money. So you're making a smaller spread, but you're attracting the talent that way.
What makes a candidate qualify? What are the things they need? I'm assuming experience, or maybe not in this type of crisis.
Even experience, license. They need to have most people in healthcare need to be licensed, right? So RNs are licensed, LPNs are licensed, nurse aides have a certificate, home health aides have a certificate. So they obviously need to meet whatever the guidelines are for the state. They also need to have an up-to-date physical, which shows that they're immune to measles, mumps, rubella, chickenpox, varicella, that they also are TB negative, so they can't have active tuberculosis, and that they're what's called, safe and fit to work. Okay, so that physical it's done annually. All healthcare workers working in direct contact with patients have to have an annual physical. So their physical needs to be up to date. But every nurse and everybody in the field knows that. So either they're getting the physicals done at the job, and they can get their physicals from their job, or they just get their physical from their doctor. But once they have that, they have the application, they filled out their W-2 forms, or their 1099 forms if they're, or W-9s if they're going to be 1099, and they have their medical clearance, and you have a copy of their license. That's what you would consider a profile for that nurse. Of course, their resume helps, but most of the time they're not even asking for the resumes because they're so behind. It's just like, does this person have at least 1 year's experience? Typically is what they're looking for. So you would also look for that. But sometimes you might have a new nurse who has maybe 8 years experience as a nurse aide that understands how things move in a nursing facility, that they'll be willing to take as well. Sometimes they orient them at the facility. It's really case by case, but at minimum, physical, licensure certificate, and identification and eligibility to work in the United States.
My graduates from my school being Forbes, bag drop.
Bag drop.
A mic drop, bag drop.
Bag drop.